What's up, everybody? How are you? It's Bill Forster, and I hope you're having a wonderful day. Of course, this is Real Talk Chronicles tonight, and this is Real Talk Chronicles with Dr. Marilyn Corder in the building, and this is Real Talk with Dr. Corder. I hope you all are having a wonderful day. We are, happy holidays. That's the only thing I can start off to say is happy holidays. I hope everybody's had a wonderful Thanksgiving. It's been a minute since the doc and I have chopped it up, but we'll get all your questions in, hopefully, and your answers, and we can give you the best hour that we got to give you. Of course, you can see the sponsors. Um, I'm in and out a lot. Been doing a lot of stuff, keeping busy. There's so much going on in the world today: wars, crimes. You got Russia, Iran. You got that war. Russia. You got Israel and the Palestinians. So there's so much. But then what we always got is health. And
Yep.
without further ado, let me invite the doctor. Doc, what's going on?
Hey, cuz, how are you?
I'm good. Happy holidays to
Hey,
you.
likewise. Hey.
Hey, how you been?
I was talking to Selma, cousin Selma. She greets everybody, says hello.
Oh, please
All
tell
is
us
well.
hello.
All is well. My Thanksgiving was good and quiet on
Good.
purpose. On
Sometimes
purpose.
we need sometimes we need that, right, Doc? We need that. Yeah,
Absolutely.
because we need to just like fall back and keep it easy and be easy with things. Because a lot of times, I mean, people don't understand like the life of anybody can be very hectic and people don't understand that. Like, you need to veg out. Where the kids any of the kids in town? I
No,
call
they
them
had
kids.
just left. I know they were greeting us. Of course, everybody was different time zones, but they were not. But it was all good. They had just left, so we were relaxing.
Good, 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 good. So, Doc, of course, it's always your show, what you want to talk about. But I know some people had some questions they asked me to ask you, and I hope they chime in tonight and talk about it. But I heard there's like some kind of new thing that came out for sickle cell. Did you hear that? I like the haircut too, to be honest with you.
Thank you. Thank you.
Yeah,
Thank
yeah,
you.
yeah, 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 yeah. Uh, but is there something that they just did to enhance the research on sickle cell? Did you hear that?
Yes, I did. It's interesting. I want to talk about. I'll talk about that briefly. There's lots of conversation and lots of I call it research with sickle cell over the years. Being that I trained at Howard University, we have a I call it a pipeline for patients who have sickle cell or have sickle cell and the families.
Hmm.
And what we have done over the years, we've done what we call a monitor and making sure they're okay, and then we've done the what we call the antibiotics that they were on for so long because of the immune system was often challenged due to the cells being sickled. And
Hmm.
then we had the um, bone marrow transplant. There was something called a bone marrow transplant that we were doing. Um, and one of my patients, well, actually, my patient was the very first bone marrow transplant here in the DMV, and that was some 30 years ago. Um, so now we are having what we call the first gene therapy to treat sickle cell. I think it's exciting. It's a cell based gene therapy and it's approved for treatment of sickle cell in patients 12 years old and above, I believe. So it's
Okay.
not yet for smaller kids. Of course, we still have problems with smaller kids because they get sick, they get pneumonia, they get crisis,
Hmm.
they get dehydrated, etc. But this is something that we'll see, and it's pricey. They talking $2 million a person. You know, in,
Mm.
in the beginning, I'm about sick of these pharmaceuticals company. They know nobody has that. So you're gonna have like a Bill Gates. You're gonna have well, he don't have sickle cell, okay,
Of
but
course,
you're
of
gonna have
course.
folks that won't have that. And I'm like, come on, let's spread the health. Let's spread the cure.
Yes,
Um,
yeah, yeah, yes.
and so I know it's brand new and it's groundbreaking, of course, but it's us to have sickle cell. And who has $2 million? You know, um, So I'm just gonna stop at that. Stay tuned.
Yes, exactly. And Doc, before we move on, can you just break down the difference between sickle cell disease and sickle cell trait?
I sure can.
Yes.
Um, so hold on, let me just tell this person I need
Sure.
to talk to them.
Go ahead. Everybody, this is Real Talk Chronicles. I'm your host, Bill Forster, with my co-host, Dr. Marilyn Corder, and this is Real Talk with Dr. Corder. If you have any questions about any medical or health issues, please write them in and ask the doctor. This is probably the only time when you're going to be able to have a experienced doctor that's going to
So
give you some kind of
I'm
time.
back.
Go ahead.
I'm back. So sickle cell, we see sickle cell trait a good 12 to 13% of African American population here in the United States. Many people have sickle cell trait, have no idea, except when either if a female is about to deliver during her prenatal course, we do a sickle cell test. Or sometimes even a baby, when the baby's born, we all do sickle cell tests. We do a heel stick and we do several tests. One of them is sickle cell. I've had many times the unfortunate um, conversation with parents who each of them was sickle cell trait, not knowing. All right, be it the father didn't know because he don't have prenatal care, and the mother may not have had prenatal care, and then they
Hmm.
deliver a baby that has sickle cell. So two
Yes.
traits can give in 25% of the time sickle cell. But a person with a trait has no illness at all. They're walking around fine, doing fine, but you need to know you need to know your status of sickle cell anyway.
Hmm.
And that's important, but you're healthy. But it's just that if you have sickle cell trait and you're healthy, that's the S trait, and your spouse or your partner or whoever you're about to have a baby with has the trait, then chances of the baby getting both of those traits is 1 in 4. Chances of the baby getting both of the traits of sickle cell disease, having one would be the trait. That's 50%. And then
Hmm.
you can have some cases where they don't get the trait at all. So let me
Right. Right.
explain. So it's like a roll of the die. You
Hmm.
have a person, a mother and father, they have the trait. So one case would be they don't have they gave their best thing without the trait to the baby. So the baby comes out no sickle cell or sickle cell trait. That's 1 in 4, 25%. Then odds are one of them will give the trait or one of the other one give the trait. So the baby be healthy but born with the trait.
Understood.
Worst case scenario, both of them gave the trait in that conception, and the baby comes out with sickle cell
Yes.
disease. And
Yes.
that's where sometimes people had no idea they had the trait. Here's the baby
Yes.
with sickle cell disease. They're like, what's going on?
Hmm.
And we test everybody, and they had the trait. So
Right.
you are
Right.
very healthy. And this is personal to me
Hmm.
because my husband has the trait,
Right. Right. Right.
sickle cell trait. I don't. So the worst case scenario, if I don't have the trait at all, and I don't, and Fred found out, the other Dr. Gordon found out he had the trait when he was in medical school. Because
Yes.
men don't know. And
Nah, yes.
he was working on the sickle cell van. He said, well, let me just test. And lo and behold, he had the trait. Okay. Men don't know. I know my status before I was even having babies because I'm
Understood.
just, I just had the best doctor in the world down here in DC.
Yeah.
But
Yeah. 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 Yeah.
now they
Absolutely.
test all the time. So make sure you know if you have the trait. Don't wait till you're pregnant.
And the thing is, I had a ex girlfriend, and I always this is how I got to find out about sickle cell, and we're going to move on in a few minutes, but that's how I found out about it, and she eventually succumbed to sickle cell disease.
Disease.
Yes, and she neither one of her parents, her mother knew that she had the trait, but her father, I guess, didn't know he had the trait. And of course, because technically you're not supposed to have a child. Back then, it's supposedly it used to be like you're not supposed to conceive if both of you have the trait.
Not necessarily. No, I mean, you just have to have your genetic counseling. You just say, because
Right.
I'm a geneticist, and I've spoken to many couples prior to even them having a baby, and I said, here's the deal: you can have a baby without the trait at all. You can have the baby 50% of the time with the trait or sickle cell, but you just got to
Mhm.
know, and then you know play
Right.
Russian roulette. But
Yeah.
but one
So
of my children have the trait.
okay, that's what I was about to ask you too. Yeah, because that can absolutely
Mhm.
happen.
One
Yeah,
does, one doesn't.
ain't that
And they are
something?
very aware of their status. So
Right.
with one that does, I said, make sure when you mate, that person doesn't have the trait. I mean, I hate to say it like that, but if I'm not trying to have a sickle cell grandchild, but I
Yeah,
do have a sickle cell trait child.
yeah,
So
yeah.
it's near and dear to me as a geneticist. Is near, and it's funny. I became a geneticist before I even had children. So
Mm, wow. Shout out to everybody chiming in. Stefania says hello. Our cousin Marquita is in the building. I always say Vera with the wonderful last name is in the building. If y'all have any questions, what's up, B? Mark? If anybody have any questions for the doctor, please ask. What's been coming up a lot um, is this RSV, COVID again, the flu. Can you talk about that? Okay, wait a minute. Here's a question, I think, or a statement. Let me show it to you. When you're ready, Doc, I'm gonna show it to you. Look at the screen. Stefania says that's from Stefania.
yeah, yeah, that is truly heartbreaking. So I should let me take a few minutes on that. So when
Mm-hmm.
a child is in crisis, sickle cell crisis, by the way, sickle cell disease is fatal. Many times people, their life is cut short because they often can get infections, pneumonias, crisis, strokes, something called chest syndrome, because the actual pathophysiology is that instead of a round cell that looks like a circle, a ball, the cells are deformed. They're sickled. They look like a sickle. And so they're trying to go through the vessels, the blood vessels, and it's not an even flow. So they get clogged up in there, especially in the joints. So many a time, there, as one person in crisis will have severe pain in the joints. It's called vaso-occlusive. Big word. Vaso mean vein, occlusive mean blocked. So they have these
Mm-hmm.
crises. Unfortunately, years ago, so many children and teenagers who had sickle cell became drug addicts because we didn't know what else to do. We were giving them pain medicine because we had to take them out of their agony. I
Right.
had a patient who ended up having sickle cell disease, SS, and she also had lupus. My Lord.
Mm.
So she ended up dying, but she lived till 40, which years ago, living till 40 with sickle cell was amazing.
Yes,
Let
it
alone
was.
living till 40 with lupus. So when you treat lupus with steroids, which is part of the treatment, that just kills you if you have sickle cell. So it was like, okay, which is the worst right now? So see, and I've had many of my patients who have been in the hospital for sickle cell, and often they have to get IV hydration, pain medicines, of course, and infection control. So yeah, it's very disheartening to see a person in crisis.
And I tell anybody if you want the real a good breakdown from a cinema standpoint, look up the old movie with Sidney Poitier called Warm December. It breaks it down. It's an excellent movie. I was so young, unbeknown to me, my mother turned me on, and we was watching it because it was Sidney Poitier, and didn't know it was such a touching story. And just to give a brief synopsis of the movie, it's a man that meets a woman that has sickle cell disease. He falls in love, and she eventually passes away. But the process that he did, and he was a doctor, but the process that he did, going with her through the whole transition, was just like it was a love story. Let me read another question. Shout out to everybody chiming in. If you got questions for the doctor, please put them in. My man James, he got a question for you, Doc. It's right there on the screen.
Oh,
You
I
see it?
like the screen approach here.
Yeah, yeah.
If so, what does the diabetes? Ha ha. You know what? I'm supposed to not tell you that it is curable. Here's the
Mm,
deal with diabetes, James. Just like we all have, unless you have your pancreas removed, your pancreas is the organ that produces insulin.
mhm.
We often will tell folks, oh, you have diabetes, so you're going to have diabetes forever. No, you're not. Well, you don't have to have diabetes forever.
Mhm.
You have diabetes or pre-diabetic, and you can reverse that. And it's not easy, but you got to get serious about it. I was
Mhm.
talking to wow, I was talking to um Aunt Kitty's niece Roz
Right,
because
right, right.
we ended up, one of the relatives just died from diabetes. Now, what ended
Mhm.
up killing him was a heart attack. Diabetes will give you a heart attack much sooner and more frequently than high blood pressure. I'm going to repeat that.
Mm.
Diabetes will give you a heart attack more often than hypertension. Now, let's go back to cure. Is it curable? It is, but you got to totally reverse some things. You got to really, you talk about declogging. You got to really reverse your life, um, you know, style. And I know that's, we like to say lifestyle, but like really reverse it in terms of the carbohydrates, the sugars. And it does not have to be sweet. Some people say, well, I don't eat sweets. Why do I have diabetes? It's what your body breaks down, and glucose. And those are carbs. Those are your those are your pastas, your breads, your, of course, your apple pies too, and the ice creams. But that breaks down. Now, here's the 3 steps. Know what your hemoglobin A1C is.
Mm-hmm.
I remember when they first came out with that test. That wasn't when I was in med school. We didn't know, and on top of that, we were just having people flip their clip their fingernail, prick their finger, get
Mm-hmm.
the level, and then come in and they would tell us like they'll write up a list. But often we see them in the hallway before they came into the clinics, and they're just writing any number. So we look at it. So who knew? But there's something called a hemoglobin A1C that when we draw your blood, we know. And it's like your report card. And it will tell you 3 months of what your glucose has been. So many people have elevated hemoglobin A1C. That's not just your one-time random glucose. That's your glucose evaluation for 3 months.
Mm-hmm.
That could be 13. It should not be over 6, and definitely not over 6.5. So
Mm-hmm.
if you religiously and really do that, you can reverse it. Yes. So what do you need to do? You have to exercise. You have to drink your water. You have to eat your natural your herbs, and eat your real food, not processed food, real
Right.
food, and
Right.
stop the sugary drinks. So I
Yeah.
and I say it over and over. You can pull it. So many people have reversed it. Herbal things reverse it. Different things that you'd be surprised. We got to do a whole show on diabetes because too many of us are dying. Too many of us
Absolutely.
have an amputation, your toe, because it cuts down on your circulation. And that
Yeah.
starts with the smaller circulation. So your toe, your foot, you hear people, your kidneys go, people on dialysis and they can't see, they have temporary blindness or permanent blindness. The next thing you know, it's attacking everything, including your heart.
Yeah, and full transparency before we move on to other questions and stuff like that. Like I'm a diabetic, so before the pandemic I was pre-diabetic, but because of the pandemic and not getting exercises like that, like I was supposed to, I became a diabetic. And you're totally right on everything you're saying about the A1Cs and stuff like that. And I just lost a friend that had an amputee. He was an amputee, and
Yeah.
then I thought he conquered it. So I mean, it's definitely important. Correct me, Doc, that you got to watch what you eat, but you also have to exercise too to keep those numbers right, because that's how I just recently got my numbers to a better place. But you definitely staying in that gym or doing whatever you do, even if it's walking.
Right.
We're older now. Sometimes we're not going to get that hard exercise that we used to when we were younger. But if you walk a mile a day, is better than not walking at all, right?
And,
Yeah.
and be positive about it. I tell folks, okay, you have diabetes, but diabetes doesn't have you. And you
Right.
really
Right.
need to know that and feel that and do that. Because there was a time you didn't have diabetes. You got the same body.
Right. Right. Right.
So
Right.
there's a time you didn't have it. So let's go back to that time.
Yeah, absolutely. My man Mark, he has stated. I'll just show it. It's more a statement than a question. He said, "My sister died at 19 from this horrible disease. I don't have the trait, but I remember my sister's death. The movie Warm December reminds me of her." Absolutely. Shout
Yeah.
out to everybody chiming in. If you got questions, please put them in for the doctor. We got it for a strong hour, and the time is ticking on it now. So, Carla, what's up, Carla? Carla has a question. Let me see. Go ahead. She says, "Hi, Bill and Doc. Have you heard of the breakdown potential treatment for sickle cell disease using, what is that? Crisis? Or
Yeah. Chris,
uh-huh.
Chris.
Yes.
I've heard of it. It's $2 million. Yeah. Mm-hmm.
Oh, yeah. So yeah, she just made that statement earlier. Yeah, she was saying
Right.
about $2 million. Mark had something he wanted to say. He says, as always, the doctor is on point with her information. I remember the horrible time my sister went through. Yeah, man. Definitely. Shout out to everybody that's chiming in, watching. Please, any questions, comments, please, no matter what ethnicity. My man, she says, I'm well on the way of reversing. Okay, Carla says, I'll put that out there. That's well to see. She says, I'm on the way of reversing. Absolutely.
That's right. Go caller. Go caller.
And my man James, he says, thank you, Doc. I appreciate you. Absolutely. Listen, everybody, You got questions, whatever your ethnicity is, whoever's watching, ask the question. She's a doctor. Of course, you know what I'm saying? She's going to give you the best advice she can. And this is probably the only time you're going to be able to talk to her and converse with her longer than you're going to be able to talk to your primary doctor. So with that being said, this is Real Talk Chronicles. That's Dr. Marilyn Corder. I am Bill Forster. Watch us the second Wednesday of every month. The next time you see her, it will be 2024. God willing, we will all be here and rocking out for that, right? And my
And
birthday.
we will be bragging about how we have conquered and on our way to conquering diabetes, hypertension,
Absolutely.
obesity.
Absolutely.
Come on,
Absolutely.
let's get on board this train of reversing these chronic illness. They don't have to
Yeah.
be chronic.
Yeah.
They can just be
Absolutely.
episodic. They don't have to be chronic.
Yeah, yeah. I mean, and that's the thing. I mean, I think a lot of us, some of us, we get something and we woe is me. You don't have to woe is me. You know what I'm saying? Let us do that. God forbid when you pass away, we'll woe is you. But as you hear, do the right thing, and you know what I'm saying. Push that button and do what you have to do to be active and proactive and preserving your life. Shout out to the birthday people. I see some birthday people in here. My man Earl, Dana, my niece, celebrating their birthdays. Anybody else, you Sagittarians, happy birthday. Enjoy while you last because Capricorn is coming, right? Oh, shout out to the Row House. Anybody celebrating their birthday want to come by the 16th of December. We're at the Row House. January 6th, I will be celebrating my birthday there. So it's going to be a festivus occasion. So Doc, let's get of course, I want you to, in a few, to talk about anything you want to talk about, but I want to get to questions about these variants that's still out here: RSV, COVID, still flu. Yeah, I mean, what's going on in this world of Oh, Stefania, that's what I meant to say. I knew you were here, Stefania. Happy birthday to you too. I knew there was another one in here. Happy birthday, Stefania.
Happy birthday, Stefania.
Yeah.
All right.
Okay.
So, it's no flu is flu. And you get it, you get it. If you don't get your shot, you still can get it. If you get your shot, you still can get the flu. So it's up to you in terms of how high risk your environment is. RSV has been around for 50, 60 years. It's not new. Respiratory syncytial virus is the name of RSV, what it stands for. We just had such the horrific surge last year because we have been in quarantine for so long. Our immune system just went to pot. Okay. So unfortunately, when folks got back out, they got much sicker, especially children. So now they have the vaccine, but they don't have enough vaccine. They got 10% of what they made only satisfied 10% of how many people really want the vaccine in terms of pediatrics. So we're talking about just reserving those few vaccines for RSV for those premature babies, for the babies who have sickle cell, for the babies who have asthma versus your healthy baby that you just say, I want to get the RSV shot. No, you don't need it. It's really, it's not a recommend. It's not mandatory. The schools are not going to kick your child out. Keep your child away from as much RSV as you can. We all get exposed to RSV 2 or 3 times. The season of RSV started in late September and it ends in March. So in other words, sometimes just wearing this mask. I still wear my mask.
Right.
Well, okay. And we know what it did for the flu. It really eliminated the flu. So RSV is respiratory spread. You're coughing. You sound like croup. It's unrelenting sometimes, but it passes. So you support it supportively, like symptomatically. You have your humidifier, your Vicks rub, your Tylenol, your fluid, your rest. Now there are times, especially with the little ones or even the elderly, that you have to get seen in the ER because there's something called your oxygenation can get affected. So you just need to know and monitor if you feel you have RSV. Don't go to the doctor and say, get me tested for RSV. Talk to them on the phone. The doctor, we don't want our waiting room full of RSV for real, but we will give you telehealth and information. And like I said, we see RSV all the time. So here's how with the flu. Now the flu is the flu again. We get different flu and we try to match the flu with the flu shot in terms of how it's effective, but it's not 100% effective. Like 2 years ago, the flu shot was only 30% effective. People were pissed. But anyway, meantime, you do what you do. You have to play the odds and try to stay away. I am exposed all the time. I'm in my office still from this morning. So I see flu, I see RSV, I see COVID. I try not to. I talk to your brother on the phone and say, "Oh,
Exactly.
you got COVID."
I don't want to see you, but I
Right,
may see you. Yeah,
and I
exactly.
come in. My child got COVID. My mama got COVID. I take care of her. Can I come in? I'm like, no, you cannot. We can
No,
talk, and
no,
this is what you do, but you're not coming in here knowingly that you've been exposed to COVID.
right.
But so, I mean, I take my herbs. I take my vitamin C. I stay immuned up. All right, so that's
So,
it. But we
so
still are in the season now. Of course, vulnerability, seniors, people who are in nursing homes, folks who have other respiratory problems, like um, let's just say not only asthma, but people have some COPD, chronic illness, chronic problems in their lungs. Those are the ones most at risk.
so let me ask you a question, and it seems like all three of these are so similar to each other, right? Is there? I mean, I'm not gonna. I don't want to say this is a dumb question because there's no any such thing as a
One
dumb
won't
question.
one won't stop the other, and yet you can get all three at the same time. And
Say okay, so yeah, that's what I'm saying. You. I thought you was going to hit a base hit, but you hitting a double and a triple on that one, right?
there you go.
So you can catch all three.
Well, you
So
can
that
have listen. You can have RSV and got the flu at the same time. And lo and behold, I hope you're not exposed to COVID. So
mm,
that would be the perfect storm.
wow, wow, okay. Because I like I said, I have a friend I know they wanted to ask questions about RSV, but I don't know if they're in the chat or they're not in the chat. But this is on them. They'll just have to go back and look at it on YouTube or something like that. So, my boy Ed, we was together this week. We had a great weekend. 50 years of friendship, brothership. He has a question right now. Can you see it, Doc? Mm-hmm.
Yeah, I see it. Okay, so what she needs to do is get serious. And I'm not saying she's not, but get real serious. In the morning, she needs to take some warm water with lemon. First thing before she eats anything else. She also needs to make sure that things like oatmeal, steel oatmeal, like the real oatmeal, not the one that's in the packages that has all the preservatives. She needs to eat 3 meals, but meals that are real. That could be breakfast. She can have a boiled egg, or she can have her oatmeal. Um, she can have an apple, some fruit, some grapefruit, or whatever. Lunchtime, she has to eat something. People with diabetes, they have to still eat. And if they don't, it aggravates the pancreas. And your body goes into what we call starvation. So small amounts, but little amounts where she is still eating. Exercise, tons of water. Get away from all the fake stuff. Get away from, are you ready for this? Artificial sweetened beverages. Stop.
Mm,
Stop. Some people, especially the old diabetics, oh, I'm just taking my, you know, Coke Zero or my whatever. I'm like, get away from that. Just drink some water. Put some
okay.
lemon in your water. Get your um apple cider vinegar.
Yeah, step your
Take
water game up. Yeah,
yeah.
apple cider vinegar.
So
Absolutely.
fruits, vegetables, everything should be colorful. I tell everybody go on a colorful menu.
Mm,
And I'm gonna tell you. Let me tell you what's a good snack. Bell peppers, cucumbers. Those are
really?
good snacks. They help energize you. Celery. They help your digestion. They enforce your immune system, and they help your pancreas. And that
Mm,
again, your pancreas, you got to love up on your pancreas. That's what makes insulin. That's what breaks down the sugar, the glucose, and doing your exercise.
wow.
And when you're drinking your coffee, put a little cinnamon in it. Stop the milk, stop the milk, and stop the cream and the sugar. Put a little, and we got the little creamers that taste hazelnut and all that. Stop all that. Stop. Get your nice coffee, blend, and put a little cinnamon in it. That
Mm,
helps
mm,
blood
mm.
pressure and diabetes.
Wow. Let me read another question. Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder. I am Bill Forster. This is Real Talk with Dr. Corder and Bill Forster. Basically, this is a family show right now tonight, y'all. Everybody. James said, this is the question I think this James had. Yes.
Ah, good question. Good question. Well, poor Chadwick, he wasn't even at the age that was recommended to get a colonoscopy, but they found out he had colon cancer. After that, it was after the fact. All right. So about 10 years ago, they were saying you don't need a colonoscopy till you're 50 or 55. Now, if it's in your genetics, and if you're eating a lot of meat over the years, you don't have to wait until you see blood in your stool. You got to look at your stool, guys. What comes out is what's going on in your body. So you got to look at your stool, and it should not be dark. It should not be red, because that means you're bleeding somewhere. There's something called polyps. Now, just because you have polyps doesn't mean you have cancer, but many polyps lead to cancer. And what is a polyp? POLPS. What it is, it's a little growth in your colon. And as you get your colonoscopy, which is just a scope that goes in your colon, and the only way to get to your colon is through your butt. Okay. So you get what we call a colonoscopy. A day before they prep you, you would be they'll tell you what to drink, what we call go lightly, citric magnesium. There's certain things you got to clean out, because when the doctor is in there and viewing, they got to see the walls. And if they don't see the walls because you're too backed up, you got to be rescheduled. And that's not nice. You don't want that. You want to get it in there and get a good view and let them see. And if they see polyps, then what they have to do, they snip it. They take them off, because
Yes.
it's not good. The polyps shouldn't be there. And some people just keep polyps. Their DNA, family history have polyps.
Yeah. Yep.
But they take them off. So going back to most appropriate time frame, by the time you're 50, you should have a colonoscopy, James. After that, it all depends, depending upon your family history, if you're high risk, depending upon what they find in the first colonoscopy. It depends also on any other symptoms. Too many people wait until they losing weight. They have funny stools, a constipation or diarrhea. Something else is going on. They get bloated, and then they go in for a colonoscopy and they find cancer. Then they have to have surgery. You know, Now, cancer of the colon doesn't, it's not a death sentence, but you would have to have, in most cases, a procedure, surgery, where depending upon the extensiveness of the cancer, the surgery may need, as they cut that area, may need you to wear a colostomy bag. Now, what is that? A colostomy bag is where you're not pooping out of your backside, you're pooping into a bag that's hanging on the side of you until whatever that procedure needs time to reanastomose. Big word, putting back together the tubing. So often you'll hear somebody say they went in, they cut the surgery, they cut the cancer out. They had a temporary time where they had a bag, you pooping in the bag, okay, and then they went back in and connected it after the area of the healing and swelling was down.
Mm-hmm.
I'm
Yeah.
glad your wife is listening, Eddie. Tell her she can do this. Look, I know we always talk about New Year's resolution. We are blessed to be alive. I just got a text. One of my classmates died. I mean, we see it all the time. We're getting up in age. I don't know how old you all are, but I used to call people my age, I used to call old. Now I can't call them old anymore.
Uh-uh.
My husband and I were laughing. We're like, oh, those are old people. Like, oh, they're our age. Ooh.
Yeah. Yeah. And it's so funny, Doc, that you said that. Eddie and this is I call them respectfully my tier one friends. Eddie and I were just together this week, and I just put it on social media. Our other friend Cooney just had his 60th birthday, and this is 10 years. This is 50 years of friendship right here. We knew each other since we were 10 years old. So I mean, he knows the family, moms, pops. I mean, your aunt and uncle. He knows them all. He knows all the extended family. So that's a brother. He's not just a friend. And then James also said, he said, thank you, Doc. Once again, I appreciate you. Everybody, that's Dr. Marilyn Corder. If you have questions, please ask. This is your time. Take advantage of it. Sometimes questions don't have to be about you, even though they can be about you. You understand what I'm trying to say? Doctor, you mentioned something about stools coming off of colonoscopies, and you also said about relieving yourself. Is there I guess a perfect stool? I mean, because you said dark, red. Sometimes people get diarrhea. Sometimes is it supposed to have some kind of shape or form to it? Please elaborate on that for us.
And I would love to, as a pediatrician, that's all we talk about. We talk poop. We
Hmm.
talk we talk about lots of things, and then
Yes.
we don't realize that our our habit, our elimination should be twice a day, up to three times a day, because that's how often we eat it. Some people say, "Oh no," I ask folks, "What's your elimination pattern?" And I love how they'll tell me, "Oh, I'm regular." I'm like, "What the hell is regular?" And they're like, "Oh, every 3 days or every other day." I said, "That's not regular.
No.
That's sick."
Mm-mm.
Okay. Regular is 2 to 3 times a day. And some
Yeah.
people, oh no, that you something wrong.
Yeah.
Well, that means that your digestion is working very, very, very well. And
Hmm.
we talk about when we were in med school, we used to have this slide. One of the lectures was studying of colon cancer. And the lecturer would have slides of all the poop of people's poop around the world. Okay.
Right.
And
Right.
you'd be surprised the socially economic challenged third world countries don't have colon cancer because they're eating grains, they're eating vegetables. What is it that they're not doing? They're not eating processed foods. They don't have McDonald's and all these other things on each corner. They're not eating junk. But what they are not eating that we tend to eat a lot of is red meat.
Mm.
Okay. Now those vegans, sometimes they work my nerves, but them vegans are living long. They don't eat
Mm.
meat. And we have to get a past that. I get more folks, my color, I had to get my steak. Years ago they couldn't afford steak. Well, guess what? Go back to the poor eating where you
Hmm.
eat fruits and vegetables because meat will stay in your colon 30 days, 60 days, 90 days. I had a patient just the other day. And see, now I'm getting real graphic because this young lady had abdominal pain. The mother said, "Oh, she's in so much pain and pain around her navel. Maybe it's a hernia. Maybe it's this." I knew what it was. It was constipation. So,
Mm.
and I'm telling her on the phone, "Oh no, she poops every day." I said, "Okay, I got you. I'm gonna order an X-ray because some people you just got to the proof is in the pudding. You got to show the picture."
Yeah.
The
Yeah.
X-ray
Yeah.
came back totally obstipated, full of you know what. If you talk about your colon, you can wrap it around the building. It was full of it. So that means
Mm.
whatever she pooped yesterday was 3 months ago poop. Yes. So you got to clean out. And see, some people, it's funny because people don't understand as they're eating foods, they're backing their food, their colon up. You have to treat your colon. That is your waste basket. And you need to get and detoxify and get the waste out. So you asked me a question. You should not see blood. It should
Hmm.
not be dark. It should not be balls. It should not be uncomfortable. It should be a well formed brown stool that's well formed. Sometimes, if you're eating foods that are really good in fiber, you may say, "Whoa, I had a lot of poop." Comfortable, a lot of poop, because that meant you emptied your colon when you sat down on that toilet.
Mm.
Stop being so daggone busy. Sit your butt down. I tell folks in the morning and in the evening, spend that time on your throne to eat food.
You know what I
Okay.
always tell people when if I send them something, depending on what the topic is, if I send them something, I said do it in your leisure time when you can go sit down and read it and give yourself some time to release yourself.
Right, right.
Yeah,
It
yeah,
is true. And
yeah,
sometimes that is your bring your phone, bring your paper, but relax and allow your colon to empty.
yeah,
Chadwick
exactly.
Boseman. Every time I think about Chadwick Boseman, why I
Yeah,
wish I was his doctor, when he
right.
was little, because I talk poop all day long. And I'm
Yeah,
teaching not only the patients, I'm teaching the parents and the grandparents. They're like, "Wow, nobody told me that. Wow."
yeah, yeah,
And I'm
yeah,
like, "Well, I'm
yeah.
here to tell you."
Yeah,
Okay.
that's crazy. Let me put up another question for you. Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder. I am Bill Foster. This is Real Talk with Dr. Corder. Please, I know you're here, but just send us some hearts anyway. So, see, okay, hold on. No, that's not what I wanted to send you. This is the one when I wanted to tag into you. All right, go ahead. Latanya's in the building. What's going on, sis? You see it, Doc? Mm-hmm.
Shingles. Oh, I don't know if anyone has ever seen somebody with shingles. They are in a ton of pain. I'm supposed to tell you it's necessary. You should get your shingles shot once you're 50 and above because shingles can really hurt. What that is, for those of us certain age who've had chicken pox, and the chicken pox are gone. I had chicken pox. I did not get the varicella. Varicella is the vaccine you get, you know, before you go to school. You get it at 1 year old and you get it at 4 years old. Well, anybody who's had chicken pox who's over 40, I guess it would be 40. Um, yeah, my kids, yeah. So I'd say anybody 35 and above had chicken pox. I mean, 35 and below had chicken pox. Maybe had no, don't had didn't have chicken pox because they had the shot. We prevented it. But us who got chicken pox, it's supposed to be dormant. It's supposed to be laying in our bodies, and we can get an outbreak with stress, etc., and get shingles. And shingles don't play. Shingles is very uncomfortable. It is an inflammation of your dermatomes, and it hurts. Anybody who knows somebody with shingles, they're not faking that pain. So there's a shot called the shingle shot. Uh, how often do you need to get it? Well, I'd say get it at least one time. I'm sure they're gonna come out with the schedule, but get it at least one time. And true transparency, have I had a shingle shot? No. Um, I hope I'm not gonna be one of those on one of the podcasts say, "Oh, I wish I had gotten it."
Right,
But
right, right, right.
but if your doctor's telling you go and get the flu shot, the shingle shot, the whatever shot, the pneumonia shot, you know, because you have some illnesses, etc., then you go ahead and do it.
Before I go to this next question, do you I mean, do you recommend the flu shot? I took it one time, doc, and I'm gonna tell you from a doc standpoint. I'm telling you from a cousin standpoint. I'll never take it again. I was so sick. I thought I was damn near dying.
My
So
mother
listen,
said the same thing. My poor
yep,
mom, she said, "Don't you ever, ever, ever." Because I'm going home with the flu shot. Come on, mom. I was taking. She said, "Don't you ever."
ever exactly. And I know your mother don't play exactly.
Okay, her lips. It was like I was like, "Whoa, okay, Doris Jean. I'm not going to try to jump up on you and stick you. I know you know I'm a doctor and I can get flu shots all day long."
Exactly.
So,
Happy holidays, Aunt Doris. Love you, miss you.
I know that's right. That's right.
Yeah. You got that question, Doc?
Yeah.
Mhm.
You know, so the heart sometimes has problems with clots, emboli, atherosclerosis, and those vessels, the coronary vessels, the big vessels, and the small vessels that supply the heart, blood going through those vessels to the heart. So what we used to say is to take a bare aspirin once a day, what we call low dose. So it's satisfied as a antithrombic. Thrombic is clot forming.
Mhm.
The aspirin slowly but surely gives you some prevention. The problem with aspirin, with low dose is what we say, we'll say the bare aspirin. But if you do high dose aspirin, you'll get a bleed because it is such a good natural or a good mild anti clot. But any anti clot can also make you bleed. So I tell everybody it's personal to you. Speak to your doctor about it, and they'll tell you how much, what dose. But some people are on medications. We call it blood thinners, and they don't need to be on aspirin if they're on blood thinners because they'll end up sneezing, blow their nose, and blood come everywhere, or they're
Mm.
shaving, or they're bruising. So there's sometimes too much can be worse than not enough.
Let me go to the next question. Everybody, um, this is Real Talk Chronicles. That's Dr. Marilyn Corder. Please subscribe to it if you're watching on YouTube. If you're watching it on Facebook, that's fine. Go to YouTube later and show and subscribe to it. I don't have a problem. I try to share the information as much as I can, but the support is definitely on both accords. But YouTube is the thing. Carla has a question for you,
I
Doc.
love Carla's question. I
Hmm.
love Carla's question. Some people said, "Yeah, I get my colonoscopy every 2 years, and so I clean out." You know what? Why wait? You don't have to get the colonoscopy every 6 months, but a colon cleanse is not a bad idea. And there are some places, now I'm not saying overwhelm yourself, but a colon cleanse, and you don't have to do a major colon cleanse. You could do the magnesium of citrate and some coffee ground. and to really make sure you know when your colon's cleansed. Some people say they get cleansed so much they feel air in their butt, in their colon. So you know when your
Mhm.
colon, but if you backed up, that's a whole nother feeling as well.
Yeah,
So
absolutely.
I feel so yes, you can. And what you could do, there's some other, there's high fiber. Make sure the Metamucil, you can increase on that. Drink your water, drink your lime, your lemon juice, get your high fiber foods, and definitely push it through. So yeah, and you just
So,
don't want to make sure you're not overwhelming yourself, and then you see blood.
so let
So
me ask you a question, Doc. Now, I mean, that's a good point that caller just asked. But let me just say, for a person that just wants to cleanse their body, period, what kind of time frame are we talking? Once a week, once every month? What like every 2 weeks?
every
What's a good
quarter,
time? Every
okay,
quarter?
you don't want to overwhelm your body too much because when you do that, you're putting your body under somewhat of a stress,
I figure that. Yeah, yeah.
and so your body is like, well, what's going on? And then what happens? Then your body goes into kind of like a mode that is trying to preserve what you got left. Like it stops metabolizing. It'll store fat because it doesn't know what's going on. Okay. And that's why when people will not eat for a while or they don't eat breakfast, you got to break the fast. Eat reasonable, but eat something. Even if it's a bag of, I'm going to show you what I had earlier today. You know, you don't have to eat breakfast. I don't eat breakfast. I didn't say eat breakfast food. Eat something. You can eat some cherries. Okay.
Mm, there you go. There you go.
Berries. You can do grapefruit. You can do a little oatmeal. You don't. It doesn't have to be eggs, but you have to eat something. Speaking of that, I got to eat a little bit.
Yeah, yeah. Go get your cherry on, dog. I was about to say if we was close right there, I was gonna say give me some. You know what I'm saying? So shit.
Oh,
You
and
know.
by the way, everybody needs to be eating beets 2 or 3 times a week.
Whoa, whoa, easy now.
Beets.
Come back, rewind with that one like a DJ.
No,
50
no.
years of hip hop. Bring that
I
back. What do you
know.
mean
Look,
beats?
I had a young parent, a young folks, and they told me they beginning to get a baby beets. I said, thank you. I get so many. Oh, I don't like beets. I don't like beets like you. Beets are excellent for iron stores. Beets give you your brain function. Beets have plenty of benefit. So start eating. You can it can be pickled beets. It can be beets in your. It can be beet juice. Get into beets. Next time I'm on here, what's that in 2024? I want y'all to tell me what your beet recipes are.
Well, you won't be hearing it from your cousin. You might have to throw you might you might have to throw some seniority on this because right now, let me tell you something. Everybody knows I got the palates of a 2-year-old. I
No,
listen. I'm not doing
you'll
that.
give me some
I'm
beet juice and you won't even know it.
I'm not eating beat
You're gonna put it
shit.
in your smoothie. You won't even know it. And you're gonna
Listen,
know, oh, that stuff is good. What
we
was
ain't
that?
we,
Beet?
we, we ain't never argue, but you put some beats in my stuff. We gonna have something to say with each other. And the thing is, it's so funny because I've had beats before in my life. You know what I'm saying? Of course, when you talk about our family and and anything old school,
Right.
you was told to eat it and made to eat it. You didn't have an option. So I get it. So as I've
Mhm.
gotten older and thinking I'm grown, I don't eat certain things. So for the people like me that are hard headed
Yep.
and they figure it's a over assumption abundance of water, something to keep them cleansed and flush them out. Because I consider myself regularly. I'm I mean, full transparency. I don't care if people want to know about my office time, but I'm like I'm like twice a day. So, but I mean, the bottom line is, I still want to be able to go in a relaxed mode. Because I mean, if you don't go and you try to strain, you can. That's how you can get hemorrhoids too, right, doc, or something like that.
Not only him, right? You can get hemorrhoids, and if you don't go and the colon is full all the time, that's a recipe for colon cancer.
Mm, mm. Something food for thought. Everybody, pay attention. You know. Let me read. My man, he just wrote this in. I want to show this. Thank you, caller, for the questions. And my man Jonathan said, "Great information." That's my guy. Hope to see you soon, Jay. Caller also said, "Oh, let me just read. Show this." She said, oh, "Okay."
Yeah, painful. Yes, yes. If you witness, so So, Carla, if you witness anybody who has shingles, you're gonna run and get your shot.
Really? It's that
Oh,
like that, huh?
hmm hmm
Oh, wow. Who knew? I'm glad I know now. But you know, it's so funny. Um, hey, Doc, is shingles? I mean, it's not similar to gout, I don't think. But I heard gout and I guess shingles. Is shingles painful? But I know I heard gout is very painful.
shingles is like on fire, and it's in your
Hmm.
dermatomes. I use CBD spray and CBD cream for my patients, well, my friends, because I don't do old people, but
Right, right.
shingle can hurt, and it's very painful. And it's like it's a little line. It's usually in the dermatome, like on the side, except but it's very painful. Yep.
Mm,
Now
okay.
gout is something different. And
Wow.
if
Okay.
you have gout is the swelling usually in your big toe, but it could be in your whole foot. And you have to watch the foods. Liver, if you eat liver and seafood, there's some foods that you should avoid if you have gout. And you need to eat tart cherries. If you this prevents gout. Tart cherries.
Oh, and I'm so glad that you're saying that because Latanya had a question, and I'm still going to post it. She said,
Hmm
what is gout? Is it curable, and how do you get rid of it?"
Okay. Well, it's you can monitor it. You don't have to always suffer from it. It's curable to the point where you prevent yourself from foods. Drink a lot of water. You want to prevent yourself eating foods that are safer than foods that cause gout. There's medications for it, allopurinol. There's medicines that can control the gout when it flares up. I call it a soft tissue arthritis. I mean, when I say that, some people have arthritis and it flares up so often. Gout sometimes can catch you off guard. You're like, oh, I got this pain, and then you realize it's your gout acting up. Then you begin to drink your water, stay off of sugary drinks, stay away from seafood. Their foods again. If you Google and just say foods that you should not eat that can aggravate your gout, there it is. That's your list right there. So that's how you get rid of it.
Okay, let me read another question. I mean, or questions and statements. They coming in. Hold on, let's see.
And I'm eating my
Oh,
cherries.
yeah, get it, Doc. That's it. This is family show. Get it. Dana says she just has some beets, like chips,
I
chip beets.
love it. Thank
Yeah.
you. You can get
All
beet
right.
chips. They have the beet. They have cute little cubes. It curtails your appetite, and it's excellent.
Yeah, okay. Y'all keep that. Anyway, my sister in martial arts and law enforcement, Mashira, she said I got my shingles vaccine shot a few months ago. Okay.
Good for you. Good for you.
Yeah, y'all go ahead. Y'all rock on. Tell me how it feel. Uh my Capricorn sister Doris is in the building. Capricorn's rock. Doris said this. Go ahead. Uh-huh. She said, "That's it's true that if you get shingles in the eye, you can go blind."
Well, funny you should say that. There's something called retinitis and inflammation, and there's something called optic nerve inflammation. So what the shingles will do, Doris? Oh, I love your name. My mom's name was Doris,
Absolutely.
and that's also my granddaughter's name.
Absolutely. Let's keep it in the family.
So the inflammation of your optic nerve, if that's inflamed, because that's what shingles will do, then you can get some irritation and some sight um, dysfunction. So good point.
Okay. Let me read. Let me show this other question. Hold on. I feel you, Ed. Tell Ree to knock it off.
I love it. I love it. And and I think that's good. And you know what else? Instead of pastas for those diabetics, get the cauliflower. I mean, oh goodness, I can't. I'm trying to remember. Yeah, cauliflower instead of regular pastas. Get your fake pastas, and it tastes just as good. Okay,
Wow.
I shouldn't
Okay.
say fake, more nutritional.
Yeah, exactly. Let me see. James got another question for you. He said, "What would you consider a balanced diet? Breakfast, lunch, or dinner?"
Okay, so I don't know if you all know that a boiled egg It's lots of protein. It helps your digestion. It helps your skin.
Ooh.
It has protein, and it's easy to digest. Okay. Um, it's inexpensive. It's easy to cook. That plus half an apple. Bananas have a lot of sugar. Now you want to drink something before you eat, be it lemon water or the um, apple cider vinegar to get your stomach in shape. And you want to drink your water, and you could do black coffee with cinnamon. So either that, but you don't want to do pancakes, and you don't want to do the heavy starches, the hash browns. You don't want to do any of that. Um, or the super breads. But oatmeal is also good. Still oatmeal is good. So that would be your breakfast. For lunch, it's
I'm glad he asked that question. Good question, James, because I want to ask you a question, Doctor.
so
And I'm about
how
to,
about this? How about anybody know about sardines?
oh wow, that's old school. Sardines with crackers. My parents.
Let me
Wow,
tell
that's
you.
old school.
Let me tell you. Sardines or tuna without the mayonnaise. For
Whoa,
sardines and
whoa,
tuna,
whoa,
you
easy
need a
with
lot
that.
of omega
Yeah,
threes.
yeah.
A little bit, a few crackers, a little olive oil, but I'm telling you, that fills you up. You drink your water, but you have to eat something. So sardines or mackerel, or again, some people say, well, I do the oatmeal in the morning and I do my boiled egg and with some salad with some roughage for lunch. Now, your dinner should be your food, your meal. That's one of your smallest meals. It should not be your heavy meal. But most people make it a heavy meal because guess what? They don't eat breakfast, or they definitely don't do lunch. So by the time dinner time comes, they're overwhelmingly hungry. And if you're super hungry, you're not going to be wise about what you're eating.
So let me ask you a question, Doc. So what about
Baked
people that
chicken,
do it?
1 second. So you can do your fish, your codfish, your baked chicken, baked fish, lots of green. This is dinner, lots of green. Sometimes I tell folks twice a week, you should have nothing but a plate of green squash, yellow, green beans, cabbage. You don't have to have the meats. You don't have to have the starches. Okay. And your body, when you start doing that, your body will say, this is like putting nice octane in the tank versus cheap stuff. And then you get
Okay.
what you eat. And you are what you eat. So let's go green. Let's go try to get as many natural things, but let's go natural things that we know our parents would have given us. Now, I'm not telling you to go drink some cod liver oil, but you can do codfish. You can do omega 3. Okay. You can stay away from all that red meat. That's what you should do. Do it for 2 weeks, and you're going to see you're going to feel a lot better, more energized, sleeping better, skin going to look better, all of that.
Yeah, well, you're right about skin because I need to get my skin checked out. I'm breaking out like I'm 6 years old, 13, going to high
Well,
school.
that's your toxins coming. Your toxins are coming to surface.
Yeah, exactly. Also, too, let me ask you a question, Doc, about when you said, of course, I know you're not advocating for red meat, but what about people that are this don't eat meat or vegans and stuff like that? Do they still need to clean their system out? Because I mean, or is they just I mean, because are they accruing more starch than or fruits and vegetables and stuff? I don't know. I'm just asking. Yeah.
Well, they still need to be regular. There you go. Rice cauliflower with pasta. That's good. Yes, Carla. That's good. The rice cauliflower, this pasta cauliflower, and it tastes good. I was introduced to it, and maybe turkey instead of red meat. So vegans still need to have, I feel, at least a cleanse. Because, depending on how their peristalsis, which is the big word for their digestive system going through.
Yeah, exactly. For you all out there, don't try to hurt yourself with that. Just listen to her. You know what I'm saying? Don't try to write it down. Just go watch the tape again. Mark said, this is my man Mark said this because he knows me. He said, "Yo, B, Italian tuna is good, bro. You ever heard of Italian tuna? Cuz I don't know
No.
where you get Mark, where you got that shit from overseas? Don't play with me. You know what I'm saying? Like, the military. He said, okay, he said that's
Well,
the tuna. He said that's a tuna without mayo, oil,
yes.
vinegar, herbs, and
Oh,
spice.
there you go. Yes, yes. And you can put some onions in it. Onions is always good. You
I
can
don't
put
eat
some
onions.
green
Knock it
pepper.
off.
And guess what? You can put mustard, which has natural turmeric.
Boy, listen, I lose weight in a minute eating at some of y'all houses. Yo, oh my God. I don't want to eat it. No. Doc, I know it's about that time. I know I apologize. I don't know if there was a topic that you really wanted to address, but I know all these people in here had stuff that they wanted to say to you. Oh, here's Malika chiming in. What did you want to say, sweetheart? Let me just show it. She says, wait a minute. That's Vera. Vera, growing up, we had to take Fletcher's.
That's right. Fletcher's castor oil or cod liver oil. That's right. There you go.
Yep.
Castor oil and shark oil. Yes, that's omega-3 that helps your gut, that replenishes and rebuild. Yes, but the foods don't have that in it anymore.
No, and then at that time, the food came with a belt with the parents, so you was made to eat it. So right now, people got choices. And what did my lovely wife say? Let me just show this. She says, "I love Italian tuna." That's nice, sweetheart.
Right.
I appreciate that.
And it's good for you.
Yeah. Okay. Moving on. Any more questions? Mark said, he said, your boy. He said, no onions, Doc. Him don't eat like that. Exactly. Exactly. Doris, you with me too, right? Doris says, nah, I'm with you. Nah, we don't play that. Mark said, James said, is sushi good, Doc?
You gotta be careful. You gotta be careful with sushi.
Oh.
The rawness. Look at some of those. I hate to say, look at TikTok. Let me tell you something. Lots of the worms are in uncooked fish. And I had a rude awakening. So parasites. So, sushi is good sometimes, but be careful. Okay, pull up sushi and parasites / worms and see what you see. Some of the medical journals, etc. And sometimes if you can put vinegar, you can put something on it, and you'll see the worms come out.
Wow. Everybody, this is Real Talk Chronicles. That's Dr. Marilyn Corder. Now, this is the time when I'm not going to mess up my family life. We good right now. Doc, is there anything you want to say before you get out of here? Give yourself a few minutes and then give us some positive affirmation. Everybody, if you like what you heard tonight, please put the hearts up, share it to your screen if you're watching from Facebook. But I ask all of you to go to YouTube and subscribe to it. If you want the doc to come back, maybe before the year's out, cool, ask her. If not, we'll see. I know, listen, and we need to get her husband on here too. Fred think he's slick, but I get it, but I'm saying, but I love my cousin rocking out with me though. I appreciate you, your expertise and our family love is
I love it. And it's interesting. So Fred is doing the other Dr. Corder, my resident. We went to medical school. He's from Detroit, Motown, and he and I have also begun to partner with something called MRT. There's going to be a whole nother discussion on that, and that's when you get your blood drawn, and it's different. Let me just say, you hear about people who get their blood drawn, and you're just asleep on the outside of the covers. Oh, yeah, it has a little sulfur. But it's okay. It'll give you a natural blowout. But the testing that we are partnered with will tell you a lot about your body. It's one thing getting an allergy test. It's one thing getting tested for gluten sensitivity. But we will have a show on how we can get you tested. It's very costly, but it's a one-time. And when you see the foods that you should not be eating because it's causing inflammation, then you're going to say, wow. And inflammation is the common denominator for all illnesses. So we'll be talking.
Oh, all absolutely. Right. I just want you to get your flowers while you're here. Let me just show you that. James said, thank you so much, Don. Right. Marks are always appreciated when she's on. Absolutely. So everybody, please give us some hearts. Go to YouTube, subscribe to the show, subscribe to the channel. If you're on Facebook, please subscribe. Share this. This is information that we need to share. We can share all kind of other ratchet stuff. We can all share about what Puffy's doing, Diddy's doing, and who's getting charged with this and that and all that other nonsense. But let's share some positive stuff, because you're not getting this as your doctor. Your doctor telling you got 15 minutes and get in and get out. I will be seeing my doctor definitely this week. Nika and I, we do this. It's so funny that when we see our doctor, we both have the same doctor, which is a beautiful thing. He laughs at us now. He's like, we make appointments one after the other. And he's just like, yo, y'all just come on in here and let's just chop it up.
Yes.
Yeah. So, Doc, give us some positive affirmation. I know you and I, we definitely, there's so much other stuff we could talk about, politics and stuff like that. Or got maybe one day, if you feel like chiming in on a Wednesday, you come in and chop it up with us on some politics and stuff like that, or anything else.
So let's keep it natural. Let's go back to some things that we used to do. Make sure your containers, stop using plastic containers, even down to the water bottles. Get your glass bottles. Make sure you're drinking your real water. Make sure that you're doing the natural things. Get your olive oil. Stop all of the other greasy things and cook with olive oil. Saute your vegetables. Your body can go back into how it was when you were a child. The organs are still there. We didn't replace them. We just have to bring them alive and like we renovate our homes and like we go and get our cars tuned up. Let's tune up our bodies. Don't wait till the first of the year. Let's get rolling now, so that when we see each other, and God willing, when we see each other in the new year 2024, we already on the road. So and it's important, and just encourage each other to do so. Okay. And when we feel down and out, go get a celery stick. Go get some cherries. Go get some beets, because that will help you, and help your mental as well as help your entire body. Thank you, and happy holidays. And maybe I will be on sooner than later.
Yeah, absolutely. Love you, cuz.
Love you too.
Happy holidays, happy New Year, Merry Christmas.
Greetings from the DMV. What happened?
That's
it. What happened to the Eagles? We gotta talk about that.
Ooh, they got smacked around. Exactly. What? Listen, talk about in the derriere. Let me tell you something. I was just talking. Of course, your team and my team, we're totally out of it. But so now, Dallas is looking like they got a game going on. Their defense is awesome. But Philly, I thought Philly was going to try to do something, but it seemed like they got scared every time they was getting hit. They was coughing up that ball.
Right. Well, my team, I wanted the Eagles, but my team is good old Mike Tomlin, the Steelers, and they just disappointed me big time. Big time. Yeah, okay, so that's a whole nother show. But anyway.
You see the doc don't know sports.
I know sports now. Bring it.
Exactly. So she can come back and we talk some sports. Oh, yo, Carla said she's about to have some sardines. Carla said Eagles, a whole other show. Exactly. Yo, you know what? If y'all want me to do a sports show, we bring Doc in. We're going to bring some people in. We're going to chop it up, because let me tell you something. O'Shea Ohtani, $700 million. Woo, 10 years. The Yankees, we got Juan Soto. Everybody. They just had the in-league basketball thing. LeBron James, Lakers, 39 years old, playing like 22.
That's right.
All the time. We'll talk about that.
He's eating sardines and beets, I bet you.
Okay, I know he's not. Okay. He's a Capricorn. He's not eating no sardines and beets. Good night, Doc. I love you. I love you. Everybody, that's Dr. Marilyn Corder. I'm Bill.
All right. I'm leaving the studio. I'm dropping the mic.
All right, dropping the mic. Everybody, please, like I said, if you like the show, subscribe to it. Keep the content going. Listen, positivity. I always say it. Malik always says, stop. It's the hardest thing to sell. I talk some ratchet stuff, sex abuse, child this, and talking about somebody, it sells. That's the easiest thing to do. I'm trying to give you some knowledge, some food for thought, something to keep you rocking and think. And then also you're getting it from me, your boy, Bill Forster, Thank you, Stefania, and happy birthday to you, Sagittarians. I got a lot of Sages in my life. So, Sages don't rock, but y'all good people. Now they stop. I'm playing Sages are cool, but Capricorns rock. And Taurians, I'm more than a follower with Taurians, so I gotta do that. But so yeah, help share the content. Wednesday, I think I'm going to be here. Hopefully, I can get the Stefani for you. We get the cop crew in here, and we can talk some stuff. A lot of stuff going on. The 16th, we at Row House. It's the anniversary of the DJs. Their 1 year anniversary. So we definitely gonna be rocking. January 6th at Row House. Celebrate my birthday. Come give me a hug, a hello. You know, let's have a drink together. Keep it moving, pushing. Is it? That's what it is. Yep. Everybody, I'm Bill Forster, Real Talk Chronicles. If I don't see you for some reason, Merry Christmas, Happy Holidays. I hope everything is beautiful. Stay safe. You know, as Malika and I say now, watch your six. Take care of your health. It's most important. Love those who love you. And those that don't love you, don't love them. You can pray for them, but don't love them. You know, I still got to go to church. I got to work on that. You know what I'm saying? All right, everybody. Peace. Talk to you in a minute. Get out of here. Oh, boy. I am now. Leave button. Well, I have to minimize it. You have to minimize it for me. I don't see the leave button. Let me see. You understand what I'm saying? I'm still. Yeah, because I must have pushed the expansion on the thing. Oh, I'm still talking. I thought I muted it.